Rob Neuenschwander. This is SOT technique, preliminary test and corrections. So the first thing I want to do with my patient, he didn't come in complaining of any hot low back, really acute pain, so I'm pretty sure he's not a Cat 3. So I'm really looking between Cat 1 and Cat 2. First thing I want to do is a postural analysis. Patient's already standing correctly, so I'm going to sit behind him. Eyeball the S2 tubercle, and David, just relax, stare straight ahead, and try to stand as straight as possible. I'm looking for any lateral sway, which would be indicative of a category 1, and I don't see any greater than a 1/4 inch. Can I have you turn to your left? And now doing a lateral analysis. Eyeballing. And he looks to be swaying a little bit anterior posterior, which would be indicative of a category 2. Next, can I have you turn to your right one more time? So I'm going to analyze the first rib. So palpate out right here. David, go ahead and flex and extend your head slowly all the way back. Good. And chin to your chest one more time and back up. So I'm looking for one rib to rise up more than the other. On his side, the left side rose up quite a bit more excessively than the right did. So that also suggests a category 2. Can I have you go ahead and lay on your back, face up right here? So this is cervical indicators. So I'm going to be just palpating, looking for tenderness. Cervical spinuses. C1 doesn't have a spinous, so I'm actually going to come to the styloids right here. And then continue down. C2, C3, 4, 5, 6, and 7. And these usually correlate with the opposite lumbar. So for instance, C1, the top cervical, is going to correlate with the lowest lumbar, be L5. C2 with L4, 3 with 3, all the way down. And they do flip-flop. So a cervical spinous usually correlates with a lumbar mammillary process. So assess those. And then I'm going to do the cervical compaction test. Slide back toward me just a little bit. So this is going to be what's called the stair step. Just checking different levels of the cervical spine. Just be C1, C2, C3, C4, C5, C6, and C7, C1. So any of these that appear a little bit sloppy, we correct with the infinity sign, just like this. It should be a nice, clean, crisp cutoff for the stair step. Next, I'm going to check for anterior. So can I have you cross your arms, roll just right here, and checking the first 4 thoracics for anterior subluxations. He appears to have one right here. I'm not going to correct, but if I were, just drop on it. Next, basic 1 and basic 3. For basic 1, I'm going to be looking for the EOP and just making a line with my other fingers out to the mastoid and just feeling for the pulsing and holding for just a minute until they become symmetrical each side. Basic 3, I'm going to be lifting the parietal bone. So palpate down the sagittal suture for an area of tenderness. Once you find it, you want to interlock your fingers like this. You're actually going to be pulling that apart and lifting the parietal bone at the same time. All right. Next, I'm going to be doing a psoas test and correction. So can I have you bring your arms straight up? So I'm going to do traction of the patient out. Make sure to pull them straight and point your fingers at me. Put them together down to his chest. He appears to have a right contracted psoas. So what I would do is walk around the patient. You can relax. For category 1 and category 3, you would actually be using the knee as well. So have you bend this? Locate the psoas right here. So can I have you take a breath in and all the way out and in, all the way out. One more time and all the way out. The only difference for category 2 is that you wouldn't be using the knee. You would just be going for the psoas by itself. You can relax that knee. Anterior iliofemoral ligament is going to be coming right here, taking the patient's ankles, internally rotating. So I'm looking for one that doesn't rotate as far, which would be the same side leg, right here on his right. So what I would do is come to the ligament. Can I have you turn your foot in and out? Finding the trochanter, a little bit superior, a little bit posterior. Just find the tissue, perfect. Okay, so go ahead and internally rotate and go ahead, turn out. Good. One more time. Turn out. Turn in, hold it right there. I'm gonna go ahead and preload. And on the last one, when I count to 3, turn your foot out as fast as you can. 1, 2, 3. Good job. The last thing that I'm gonna do is the arm fossa test. I'll test his right side first. So I want you to bring your arm up, make a loose fist, turn this way. All right, so what I want you to do is just hold right there, pull towards your head. So find the ligament. Kind of have you take your left hand, put the heel of your hand on your belly button, and there should be a pubic bone right under your fingers. You find that? Yes. Okay, you can move your hand. So this is the ligament I'm looking for, is going to be right here in this area. I'm going to test the superior part of it first, right here, and go ahead, pull. And that's strong muscle. And test the inferior part, pull, and that's strong as well. And can I have you bring your right arm up? So the same test, pubic bone one more time for me, right there. Cool. So superior part of the muscle, hold, good job. And inferior, hold, good job. You can relax. And those are preliminary tests.